Alright, so today we're trying to follow up on the Brant Ruff MRI that I had done in 2019. I was referred to this scan by Northside Medical Associates nurse James Frankie Crum. This is now Complete Health, owned by Pharaoh's Capital. This is located off of Happy Hollow Road, Trussville, Alabama, headquarters in Pell City. Brant Ruff is a doctor who read the MRI for St. Vincent's Ambulatory Healthcare Network, LLC. That's Ascension. If you're following my documentation, you'll note here that in Birmingham, Alabama, we got a real big problem with responsibility, accountability, and radiology. And this week I talked to the two main radiology companies in Birmingham, Alabama. And I recently spoke with Doyle Stewart, CEO of Birmingham Radiological Group. According to their website, they have 38 radiologists who work with them. And here in this call, you'll hear me speaking with Kim Mooney. She is the administrative coordinator at Vulcan Imaging Associates. And she states that they have 37 radiologists who work with them. So if you got radiology issues, you go into a medical practice or hospital, doctor, you have an x-ray, MRI, CT scan, these are the types of doctors, and these may be the actual doctors who will be looking at your scan in the Birmingham area. And according to my findings here, not very reassuring. If your scan is misread, you discover this and you try to seek a redress on these misdiagnosis issues. Not encouraging, my experience here.
You have reached Vulcan Imaging. Vulcan Imaging, this is Kim.
Yes, ma'am. I called last week. I was trying to get in touch with one of your radiologists, Dr. Brant Ruff. I had an MRI scan that was looked at by this doctor in 2019. I got a report with his signature on it saying I don't have injuries. However, in the MRI images themselves, I have evidence of a very serious head trauma-based injury. And I was told last week that you guys would try to have this doctor get in touch with me, so it's been about a week, and I just wanted to see what the status of that was.
Okay, so I did look into this, and based on, there's not anything else we can do, so there's not anything that Dr. Ruff can do to assist you with that since the report's already been read. So there's not anything we can do.
Well, I beg to differ. This was a $700 MRI scan. This doctor was paid to have this scan looked at, and he did not note the injuries. So he is at fault. And so is Vulcan Imaging.
We stand by that report 100%.
Okay, well, the report is in error 100%, ma'am. Can I speak to somebody in management?
Yes, sir. I am the practice administrator.
Okay, can I speak to the head of the company?
Let's see.
Who's above you?
The chairman of the board.
Okay, well, I need to speak to somebody in authority because you're in error with your statement, ma'am. Not professional.
I am so sorry you feel that way, but we stand.
Well, it's not how I feel. It's the facts, ma'am.
Well, now, what you're stating, we would respond. Maybe if you consulted an attorney to have.
Well, if I can't speak to somebody on the telephone about this, I'd be happy to come clear it up in person.
You're more than welcome to come up here and talk to whoever you need to talk to.
Because this is a serious issue.
I understand that from your perspective.
Yeah, your excuses aren't going to cut it either, ma'am.
It's not an excuse, sir. I really don't know how to help.
What you should do is, you're in business, all right? Well, you have doctors who went to school for 10 years. They're millionaires, okay? They're reading radiology reports for hospitals and other doctors, okay? What you need to do is you need to have them do their job correctly. And if they miss major injuries in patients that they almost died from, such as myself, you need to simply make an attempt to correct this error. Now, I could get in touch with Dr. Michael Brant Ruff. I could supply my records. He could look at these images again, and we could clear this up in a few minutes. Could I please talk to him?
No, sir, I can't reach out to Dr. Ruff. We don't consult with patients.
That's a very sorry excuse, ma'am.
I'm so sorry. That's our policy. Let's see. What can I do to help you? Let's see. Eric Blackman is my CEO.
Well, I mean, why are you mentioning his name? Why don't you just connect me to him?
He's not in the office.
Oh, that's pretty convenient, huh?
Well, it's the truth.
Well, I don't believe you.
I'm so sorry about that.
Yeah, me too.
Let's see. What I can do is I can give you. Let's see. His direct number is.
How many radiologists work for your company, ma'am?
I have 37.
So you have 37. Why don't you take this scan, call somebody right now, and have them look at this scan and correct this issue for me?
But that is not how radiology works. We can only
Yeah, you're not professional. We've already established that.